What happens when your hair loss goes too far and nothing seems to work? This patient reached this point and then something happened which turned around his life. He almost lost his chance to have a normal, natural hairline forever. But then he saw one of our videos and came for consultation. I will tell you in today's video exactly what was his problem and how he got help by a hair transplant procedure. So this shows what can happen to you when you get help right in time. Hi, my name is Dr. Preeti Saraswat. Today we'll be learning from this patient's video journey of hair transplant for strengthening his hairline. So if you are suffering from hair loss, this video might be a roadmap for you. If you're having hair thinning, hair loss, receding hairline, just hit the subscribe button for this channel because here you get a guided information. So here we have a 27-year-old guy who has non-existent hairline, let us say, see in his picture. And he wants to strengthen his hairline, get a frame for his face. He works in IT sector, is very much concerned regarding his looks, and he has ticked in his patient form that he's slightly distressed by his looks and he avoids social functions because of that. So before undergoing surgery, he took help of PeekAI feature of Saraswat Hospital App. He uploaded his pictures and got back his probable results within 24 to 48 hours. You can do that for yourself too. Do not forget to press the like button if you're learning something new. Norwood scale baldness for him was around 3, and that too we can say 3A because he had very less hair in the anterior segment also. So we decided a mature hairline for him since he was 27, and doing his trichoscopy we could understand that he has proper donor area with good grafts. So on your screen you can see the trichoscopic features of this patient in which the CV is more than 12. Normal range is between 5 to 15. More than 12 means it's extremely good. We could very comfortably take out the required number of grafts. When we did his donor area and recipient area marking, we could make out that he needed around 2100 grafts, which we could get easily from his donor area. He was slightly apprehensive regarding pain, but then we explained to him that we'll be giving vibration along with the local anesthesia, which is given by very tiny needle, and therefore it is bearable, and after that there would be a ring block, so no pain at all. We are very much concerned about safety of all of our patients here, so we have state-of-the-art OT with all the required machines in case of any emergency. If you have any question regarding the procedure, or if you want to know your grade, or you already know your grade of hair loss and you want to share with us, you are welcome to write in the comment section below. So the patient was comfortable in follicular unit excision method, in which we try to take out the good grafts by means of the punching method by FUE method. And so FUE method was used for him to take out around 2100 grafts, and they were then implanted into the pre-made slits. If you want a personalized treatment plan, you can click the link in the description, or you can call us on these numbers to book a consultation. Now you appreciate the pictures of this patient on the day of surgery, after 3 months of surgery, after 5 months of surgery, and now after 8 months of surgery. You will also appreciate the combing video of the patient, which shows the excellent growth of grafts he has, giving him a very good hairline, forming a frame for his face and getting rid of non-existent hairline. Share this video with somebody who needs hope for a good hairline. In order to find out cost of hair transplant, you can click the link on the left, and hair transplant explained step by step, you can click the link on the right.